Well, I just left the plenary session that was the last of the American Academy of Neurology, and I have to tell you, I'm impressed by the very wonderful presentation that was delivered by one of my colleagues at the NINDS, Dr. Tamdiset, who actually presented evidence across the fields of Alzheimer's, Parkinson's, and ALS to propose that the anti-protein approach to these conditions, in fact, is not quite panning out in a manner that we would have hoped. And he reviewed the data of lecanemab, which was recently approved by the FDA, as well as data on anti-tau therapies and anti-synuclein therapies, and concluded that, in fact, there is still uncertainty as to what the therapies are doing, and perhaps we need to evaluate these therapies better. He, in fact, called for the companies that are behind each of these trials to release the data so that we can understand issues that relate to safety and better understand the relationship between risks and benefits. So that was very interesting. I've been interested in reviewing this approach. It seems natural and logical to try to target therapies, to try to target proteins, but in fact, altogether, the evidence that he reviewed suggests that this approach may not be one that will ultimately prove to give patients the best overall outcome and the most favorable risk benefit that they deserve. So I thought that was a very critical, very important presentation, and I thought he was very courageous to do this for the audience at the AEN.